This is Karen with NewClevelandRadio.net, and it is time for Care Notes. Care Notes is brought to you by Cherished Companions, and the discussion today is being led by the one and only Doug Wilber. Welcome, Doug.
Hi, how are you today?
I'm doing great. The sun is shining. I think summer has finally arrived, and some of us are getting out a little bit more than we were before, so that's a good thing.
Yeah, it is a good thing. I think outside is good. It's one thing that I've heard about is that things that are around outside activities, like bike shops, have waiting lists now, and or they're extremely busy as far as getting bikes out, and boat shops. People that specialize in boats are having trouble keeping up because they have so many people doing orders, because people are doing staycations and realizing that the outside is good and fresh air is good and sunshine is good. So maybe we're going to be a healthier population after all this stuff is done.
Well, I certainly hope so, because every morning I know that I go out and I walk around our condo development. We're in the middle of the national park, and I've always appreciated it, but not like I do now that I'm walking around. And I'm finding that so many of my neighbors are doing the exact same thing. And it's just a pleasure to be able to see people out and about, where in the past we were in our cars going in some, obscure direction.
Right. Yeah, no, the sidewalks are definitely fuller than they used to be, and the hiking trails are definitely fuller. You actually have to be careful to social distance. I was in the national park last weekend, and there was a lot of people, and so you have to be careful there, just so that there is enough distance between people. So, well, today I want to spend some time really talking about choices during a time of epidemic, and I have, as I've really thought through this subject, I've been concerned about a few things. One is that people are knowing what their choices are when it comes to giving care for their loved ones or for themselves, and that they are hopefully armed with the information so that they can make good choices. One of the things that I would like to at least, I guess one of the reasons I even came up with this as a topic is not only what we've experienced as far as the demand for care that we've gotten, but also that there is this whole other issue that people aren't talking about a lot, and that is what's happened at the nursing homes and the care facilities. And what brought it to my attention is I saw a headline that said that 50,000 people have passed away from COVID that are related to nursing homes and nursing home type of care. So facility care, I guess, is probably a better way to say it. I think it's broader than just the nursing homes, but assisted living and other things. And well, if you think about the number of people that have died from COVID, and then you look at that 50,000 number, that means that 40 to 50% of all deaths have been related to nursing homes, and knowing that is very, very important as you're trying to make decisions for a loved one. And this is not pointing a finger at nursing homes and how terrible they've been or anything like that. That's not the purpose of this, and it's not my belief either. I think that what it is indicative of is that care, when you're in a facility, it has sort of some innate risks. And whether it be getting a flu or getting the COVID virus, you have a higher chance or higher incidence of things like that statistically. And I have to go not individually, but statistically, because of the fact that spread is much easier in any type of institutional setting.
Sure.
So, for example, that's why over the years you have seen things like cruise ships have outbreaks happen. And, recently we saw the outbreak for COVID, but that's not the first outbreak that you've heard, of on a cruise ship, or a hotel type of facility. Remember the old, they have the Legionnaire's disease.
Right,
well,
right.
Where did that happen? Well, that happened when the Legionnaires were having a meeting, and it so happened that many people got this when they were in sort of a institutional or a group setting. And so and that's a lot of the ideas around social distancing and other things is trying to prevent exposure, and you prevent exposure largely by preventing exposure to lots of other people. A limited group of people is much better than a larger group of people.
Sure.
We're not over with this this situation, and that's also an important thing. I think we've had a lull, and thank goodness we have. And numbers are going down, and other things, and whether we get a resurgence or not, Lord willing, we won't. But the likelihood is there will be some sort of bounce back, and likely in the fall is when you can, and you're going to have pockets, you're going to have facilities, you're going to have situations where it's going to bounce up, or a city or a town, and so just being aware of that and what is behind it, I think, is really important. But that's where I want to kind of talk about where home care and keeping someone at home, I feel really, really passionate about. And here's why, is because I really believe our experience, we've been able to see how we've saved a lot of lives. And I mean that in that, our folks that we've had, have fortunately really not had a lot of issues. And I say that with the idea that not only did we do things right, as a company, and I really believe that we have, but I think that's also been the experience nationwide with other home care companies. And I believe that the reason is because you minimize your risk when you're at home. And as people are thinking about what they're going to do with a loved one, you have someone that is kind of having more issues. I think that this is a good, really an object lesson in why home is a really, really important choice for people as you're weighing things out. And that's one of the things that I really want to emphasize is that choice and being able to stay at home may be not only a good choice, but maybe a really, really important choice, because it may save your loved one's life in this, And again, any situation you can have exposure, on an individual level. But I'm talking about kind of, if you look at big picture, and you see from a big picture standpoint how staying at home will statistically benefit more people than being in a facility. So I think, I've always been, and I started the company because I believed in the advantages of home care. But this is driving home a really important thing, and that is the spread of disease, the spread of bacteria, the spread of virus is definitely lower generally in a home setting than in a facility setting.
So what do you say to the family who says, well, if my parent remains at home, even though I can get home care and home care will come in for X amount of hours during the day, what about their social life? If they were in a facility, they would have activities going on. But at home, it's just, my parent and the caregiver, my parent and myself when I come to visit.
Here's what I would say to that, and especially right now, what I can tell you is this: when someone's in a facility at this point in time, and we take a snapshot right now, they are isolated largely in their rooms. There are not group activities right now going on in a facility. So, and that could be one positive for a facility in general. It is not an argument for a facility now because they have limited almost all activities in almost all the facilities that I'm aware of. So, social interaction, they're not allowing people largely to get together. Families are not able to even spend time. So the social isolation right now in facilities is awful. And again, I am not doing this to pick on facilities.
Oh, absolutely.
I'm doing
I understand.
I really want to emphasize because there is a time and a place for everything, and everyone. So, but the facilities right now are so locked down that they're generally not allowing families in to be with their loved ones. And I think I may have mentioned this the last time we met, but one of the real sad pictures is something that I've seen over and over is a caregiver, or excuse me, not a caregiver, a loved one sitting outside the window of their person that they sort of belong to,
right.
That is in the facility, and that they're trying to communicate through the window, and they're actually talking to each other on the telephone.
Right.
And in order to see each other and to bring about some sort of social contact, they're actually doing it through the window. So, kind of any benefit there might be to being and doing social activities or other things has largely been eliminated right now. Now, that'll slowly but surely at some point in time come back. My guess is that's likely to come back really after there is, the pandemic is over. I think there'll be some loosening beforehand, but I think largely they're going to have to keep many of these protocols in place because of the fact that, they don't want things spreading and they don't want someone to get this because of the first statistic that I said, which was, that so many of the people that have actually passed away have passed away because they got COVID in a facility.
Right. And, and as I look at, the options of both, I agree with you. Sometimes there is a very good reason why, your loved one is going to be in a facility. They may need more medical care than, you might be able to receive at home 24/7. But I have found this whole situation to be very sad. I have a number of friends who have parents who are living in assisted living, and they have not been able to see them. They drop off packages, at the front door of the facilities, and they're hoping that their family's getting them. And I just keep thinking about if their parent was either in their home or their own home, there would be a better opportunity to be able to communicate with them and see them and know that they're getting the best that they can right now.
Right. Well, one of the things that people can do in a home setting, which is nice, is you can kind of regulate who is coming and going.
Right.
And so you could say, kind of pre-screen and say, yeah, we think, our grandchildren are not doing certain things and they've been isolated. So we're going to allow them to visit grandma and grandpa, and you can make those choices in a home setting, whereas you can't make those choices and for good reason in a facility setting, because the facilities are trying to protect a large group of people. And, they don't know if someone's necessarily understands or is telling the truth or whatever. I also think that it does bring up an important point, which is we've had a lot of people in facilities that we've helped where we're actually going in and being the surrogate for a family member. Okay. Because we're professional caregivers, we can actually go in and break that social isolation by interacting with people and doing things with them and taking them places within the building sometimes, but mostly interacting with people and doing activities with them. So we're stepping in and being able to take the place of the old activities that are being done. So know that is one option that someone has, is to use a company like ours to be able to step in and do one-on-one interaction. And I think that the social isolation, as I was talking before, is really scary.
Absolutely.
We have seen so many people just degenerating in the facilities. We're getting calls now left and right where people are saying, I put my family member into this facility, and because of the isolation, they're not complaining about what the facilities are doing. They're just saying, this is what's happened. Because of that, we've really seen a decline in our mother or our father or whatever, and they're not walking much. They're a fall risk now because they're not getting around in the
right.
facility. They're kind of sitting there. Well, that's not good. It really is not good. And so I think that that somehow people have to think, how do we break this?
Right.
And there are different ways. You can send someone like us in, or you can pull a family member out at times, bring them back home, and have care there. I think the biggest fear a lot of times people have is that they won't be able to handle it, having a person home. They feel like they're going to end up, not being able to provide the care. And we can work together with the individuals or any of the companies out there to kind of come up with a plan, to be able to say, what is going to work out well, so that the person that, say, is planning the care, the family member, is able to have the right care, not strain themselves or not, overdo things themselves, and provide a good environment that is hopefully safer for the individual in a home setting,
right.
and not break the bank. Because generally speaking, home care can be done, if done right and done with the kind of the right mindset, for in most cases a better cost than you can get by being in a facility.
Right.
So money shouldn't be an object either. There's usually, where there's a will, there's a way, and we can typically figure out a way to make things cost effective for folks in a home setting.
And it's interesting that you say that, because the last year of my mother's life, she wasn't sick, but she was just sort of getting tired of some of the routines that were happening where she lived. And she'd say, I'm not going down for that lecture because I heard it last year. And I'm not going down for that movie because I can get a better movie on my TV. And so she was spending more and more time alone. And
Right.
we were very concerned about that. And so my brother looked into it, and he brought in home care for her. And she didn't even realize that's what it was, okay? Somebody was coming and, either having lunch with her in her apartment, or suggesting that they go for a walk, or maybe she did some shopping for my mother and she was bringing, her groceries or things to her. So my mother saw it as a social engagement. And, I think, that's what it sounds like a lot of your people do, that, we're not just caregivers in the fact that we're, providing some, medical services to you. We're providing you some social interaction.
Right. Yeah, exactly. And, things too, it's a lot of people as they get older, they develop dementia, and dementia especially is one where a facility tends not to be all that beneficial for someone with dementia. And the reason is because you have to enter someone with dementia into their world, into their reality. And other people with dementia can't do that, but someone who understands dementia and understands that you have to enter into their reality, their world, is able to do that interaction. So even in a facility, the majority of interaction that typically happens between a caregiver and a person with dementia, not from other people with dementia interacting together. And that's important to know, because as you kind of make plans, and try to figure out things, you have to get the big picture, and you have to understand, what's going on and how to deal with it. But the pandemic, again, I think what it's largely done is it has kind of exposed some of those raw parts of institutional care. I've long felt that we are sort of in an interesting time, because like in the past, and I think I've used this analogy, tell me if I have, but in the past there's been kind of everything was more institutionalized, it was more industrial as far as the organizational structure of how we take care of problems. And so, 100 years ago you had, or 150 years ago as well, you had orphanages. That made sense. You kind of warehouse people in those situations, and did same thing with insane asylums and other things where they kind of warehoused people. But we've largely moved away from that model. It's not that there isn't a time and a place for some kind of institutional care for those that are orphans, or for those that have some sort of mental issues. But largely we've tried to move away from that group setting, because the sort of the negative parts that come with that. And I always thought that, or I've not always, but I've kind of come to the conclusion that we're going to have a similar realization when it comes to how we're dealing with our people that are aging. That kind of putting them into a facility is probably not the best answer, and we have to figure out a way that largely we can break them free. And I think that the COVID issue has helped to kind of bring out some of the issues that have happened with facilities to the forefront. And that, like I had mentioned at the beginning, these are things that have been going on all along. It just is brought it to a a crescendo,
Yep.
and I think that is it's not necessarily a good part of the COVID thing, but it is a part that maybe may help hasten along, my ideas or my thoughts around that home is more and more going to be the first choice rather than another choice.
And it's interesting that you bring that up, because I remember in the 5 or 6 years that my mother lived in independent living, flu season, I cannot tell you how many times, we heard that she was, she had to stay in her apartment, and she kept saying, but I independently live here. And they would say, yes, but we don't want you going down the hall and walking by somebody who has the flu. And family members weren't allowed to come in. And obviously it wasn't 3 months worth of being quarantined, but, it could be a week or two where everything went into lockdown until, they figured out, who was sick, who wasn't sick, and got the place cleaned down again. And I never thought of it in that sense, but that had to have been very difficult on my mother, because, why should I be locked up into my, locked away? And that's got to be difficult for older people.
Yeah, it's this whole thing has really been sad. We get the phone calls, and it really, I can't tell you how the staff are responding to this. It just breaks people's hearts as you hear the story after story after story of people with the isolation, with the spread of the disease within it, the fear, the consternation around being in a facility, almost feeling trapped within the facility, having really difficult choices that have to be made, and within the facilities, and how to do it and what to do. One thing I will say is that as people are weighing out things, whether it be for a family member that's in a facility or for people that are contemplating, what to do with their mom and dad right now, is to really think through things. That's all I can say. I will never tell someone what they should do. I absolutely. I have strong opinions on what I think is good or not, but I would never tell that. What I would recommend is that people open their eyes and see what choices they have, and then really think through those choices and try to figure out what is right for their family member, and also what is right currently for their family member. You might make a different choice in 2 years, but right now you have to say, what is the reality that we're involved in? And I can tell you the reality that most people are seeing when it comes to more of an institutionalized setting are lots of not good choices, not good things that are going on because of isolation and because of not being able to see family members and because of lower activities, and because of a whole bunch of other things. I also want people to be aware that when it comes to home care, especially, there is no cookie cutter situation, that it is tailored to an individual needs, and it's based on what choices that a family makes. So, for example, a family may say, look, we really want mom to be home. This is where she's at. We think that, she needs just a couple times a week someone coming in and cooking meals and spending time with mom and other things. But we as a family can spend, other days here. So we'll split it up. We'll have home care do, some things, and then we're going to come in and we're going to do other things. And, we'll just kind of balance it out and, give that type of good life we feel like mom or dad can get in a home setting. And whereas other people, they may need more intensive type of care. We got a call today from someone who, is out of town. So it's a husband and wife. They needed care for, one of the parents. And the care, needs to be pretty significant in this case because it was neurological. And what would make sense for that individual is different from another setting because the family members are out of town, so they're not able to do the help. So, that person is going to need a different type of care and a different level of care than if you have a fully functioning family that are doing, lots of things with a parent and things. But in either case, what our role is, and any good provider would be to sit down and to say, okay, what are the needs? Where are the issues? Where are the holes? And how can we figure out what family can do, what we can do, what a spouse can do, and let's work out an ideal plan. And we're really good at working out those ideal plans, and then know that those plans change because as people age and as other things happen, that's the plan for now may not be the same plan in 9 months or a year because things change.
Sure.
And as I mentioned before, typically it can be very cost effective. So we try to figure out a way so that this is as affordable as possible. I will never say that it's cheap, but I can say that we are an affordable option, and usually a more affordable option than typically what you find in an institutional setting. And my belief is obviously, as I mentioned throughout this whole thing,
absolutely,
pretty passionately better, better option.
Well, and most people, when they think about living out the rest of their days, typically want to be at home. And, that's something that a discussion that, hopefully should start early on so that parents can make their wishes known to their children and their children can, plan for it. And I know it's a conversation that my husband and I have had with our two sons, and we've said, if there's no other choice, I mean, if it really comes down to it that, we're not living in the same town and you can't get us the care that we would need, that's one thing. But as long as, you could get us the care that we would need in our home, that's where we want to be. And, we did the best that we could for my mom. And even when she was living in independent living, she didn't see herself living in an institution. She had a lot of freedom, except for when they closed down because of the flu or something like that. But she got through that.
Independent living is kind of a different animal. It really is not. It really is trying to reflect, I think, some of the values that I've talked about,
right,
which is, promoting independence, but taking away some of the burden. Things like meals, or at least dinners, many of them are oftentimes an option for someone, having it so that they have a regular apartment. That's a different, like I said, it's a different animal.
Sure.
And I think that is one that you still have dangers, and the danger, I think, currently is a little bit higher because of the COVID, or even like you had mentioned before, regular flu even can be a problem in that setting, because it still is institutional, in the sense that you have a lot of exposure of people, that have similar comorbidities and other issues that can make it spread quickly in that setting. Shared air systems frequently, other things that may make a difference, but I do put that in a very different category than it's because it's more apartment-like.
Right, exactly. So how can people find you if they want to talk to you about their needs and, possibly start setting up some home care for their loved ones?
You can go online and look at our website, cherishedAgency.com. That's CHERISHEDAGENCY, cherishedAgency.com. Or, the best thing I think is to have a phone call. And, we answer our phone. You're not, that's one of my beliefs, is that the phone needs to be answered by real people, by our employees. So if you call us, you're actually going to get someone who can help you. And that's 440-484-5390. And people are welcome to ask for me personally. And I'll gladly talk to them. And I think that the big thing is, when you're going through situations, you don't need someone pressuring you. You don't need someone having a specific agenda that they're trying to do. What people need is information so they can make decisions, and they need someone who's wanting to help them with making that decision, and arming people with lots of the information that they need to do it properly. So that's the best way, 440-484-5390. And that's really what I have today. I think that headline that I saw this morning with 50,000 was one that kind of fired me up.
Right.
Because, when the history books are written about COVID, I think one of the things we're going to realize is that this was one of those things where it was institutionally spread, and a really vulnerable population was exposed, and again, just because of the structure of how a lot of people are taken care of in our society.
Right.
So thanks for listening.
Well,
thanks for bouncing things back and forth with me, Karen.
Well, I always appreciate these conversations, because whether you have an elderly parent now or you are getting elderly, we're all going to get there at some point. And having these conversations opens up our eyes to look at, what is the best thing for our family. And that's what you're all about, is helping people determine what is best for them. So thank you.
All right. Take care.
Have a great day. Bye-bye now.